The COMiSS is a real breakthrough for healthcare professionals in the awareness and management of cow's milk protein allergy. Cow's milk protein allergy is a very frequent disease worldwide. The problem is that it comes in non-specific symptoms, and it is difficult to relate them to cow's milk allergy. This is very important because cow's milk allergy appears during a critical phase of infant development. However, an expert panel has developed a tool to help healthcare professionals, the cow's milk-related symptom score, known as COMiSS. It's an easy-to-use scoring system that takes just a few minutes to complete with parent and baby. It's based on a defined scoring system, and it helps to assess the major non-specific symptoms: crying, regurgitation, stool, skin, and respiratory. The final score can be calculated that will indicate to a high degree of accuracy the likelihood of cow's milk protein allergy. This then allows therapeutic approaches to be considered much earlier in the infant's life. It's a significant advance that empowers and equips the primary healthcare professional to manage the condition much earlier. Otherwise, cow's milk protein allergy can only be confirmed by an elimination diet followed by an oral food challenge. The COMiSS can also be used to evaluate and quantify the evolution of symptoms during any therapeutic approach. It is available in hard copy. It can be downloaded from the web or completed online. In the consultation, the first thing to confirm with the parent is if the child, if aged between 2 weeks and 4 months, has been frequently crying for 1 week or more without any obvious cause. If that is the case, the crying is a symptom that you should include in the COMiSS score. The longer the crying, which can relate to colic, the higher the score. For example, if the baby is crying between 2 and 3 hours a day, mark a score of 3 on the scorecard. Next, score regurgitation. The options 0 to 6 rate the volume and severity of regurgitation. For example, 0 to 2 episodes a day would score 0, while regurgitation of the complete feed after each feeding would score 6. Then, with the parent, using the chart of an established stool scale, evaluate the consistency of the stool the infant has been typically producing for a 1-week period or more. The stools are classified by type. Type 3 and 4, normal stools, are marked as 0. Type 7, watery stools, would be marked as 6. Home and skin symptoms are also considered. Atopic eczema can be scored using an estimation of the skin surface covered by dermatitis. For example, if moderate atopic eczema appears on the head and the feet, that would be 4. If urticaria is present, add 6 to the score. Respiratory symptoms are the final symptom to be scored, although they have been given less weighting in the scoring. This is because, even though we know that respiratory symptoms can be caused by cow's milk, most of the time, chronic cough, a runny nose, or even wheezing are caused by viral infection. The scores range from 0 for no respiratory symptoms to 3 for severe symptoms. You can calculate the total COMiSS score, which will range from 0 to 33. 12 indicates the involvement of at least 2 severe symptoms. When it is above 12, it indicates at least 3 symptoms and the involvement of 2 different organ systems. If the score is below 12, the symptoms are less likely to be related to cow's milk, and you would look for other causes. A final diagnosis of cow's milk protein allergy can only be confirmed by an elimination diet, followed by an oral food challenge. Initial clinical trials using the COMiSS have shown that the predictive value of the tool is 80%. This is based upon a score of 12 or more being recorded and an elimination diet being followed using an extensively hydrolyzed formula. In 80% of cases, if the COMiSS is reapplied 2 weeks later, a score of 6 or below is recorded.